Hi everybody, and thank you for joining me in this short video presentation regarding the ECG exercise number 5 from 6th of July 2020. I hope you will enjoy this short video and join me in my future video presentations. This patient was presenting with recurrent palpitation and tachycardia. He already underwent pulmonary vein isolation for paroxysmal atrial fibrillation in an external hospital. Shortly after the procedure, the patient was presenting to our chest pain unit because of recurrent tachycardia. This ECG shows an irregular rhythm with a rapid ventricular response. One might assume that this rhythm is caused by atrial fibrillation because of the irregularity. However, careful inspection of this ECG shows that there is a regular atrial activity best seen in lead V1 with decremental conduction properties and resulting block of atrial activity. The patient underwent EP study where this arrhythmia was induced. The following was his intracardiac CS activation. The intracardial recordings show a regular atrial activity with irregular ventricular response as already suspected by reviewing the surface ECG. The activation map had shown the earliest activation in the superior portion of the crista terminalis where the tachycardia was successfully terminated by the RF ablation. Revisiting his previous ECGs had shown no different rhythm than this one. Therefore, the patient was misdiagnosed with atrial fibrillation and underwent unnecessary anticoagulation and pulmonary vein isolation. Therefore, careful inspection of ECG is highly necessary even in patients with irregular ventricular activation to rule out a regular atrial rhythm with decremental conduction properties of the AV node as potential differential diagnosis for atrial fibrillation. Once again, thank you for joining us in this short video presentation, and we hope to have you here in future ECG exercises.